So my name's Dr. Jeffrey Pentek, and I am the current podiatrist out at the Virginia Mason Bainbridge Island facility. Podiatry is a medical specialty that specifically focuses on foot and ankle pathology and their respective treatments for those conditions. The main reason why I chose it is really just the fact that I wanted to find a career where I'd be able to help people on a one-on-one setting. And podiatry was of great interest to me because I essentially could help people by making them more functional in their everyday life. So I first learned what a podiatrist was when I was in college, and I was running fairly competitively on the cross-country and track teams at the time. And so one of the main pulls to podiatry was also the sports medicine aspect. I eventually went on to do my podiatry training down in Chicago, and then eventually went out and did my residency in Detroit. Because I did have such an interest in sports medicine, I also went on to do a sports medicine fellowship here at Virginia Mason. I think a sports medicine approach is actually beneficial to all patients, as ultimately everybody has some goal as it pertains to their activities. And this holds true for people just trying to get back to their everyday life, get back to their work, all the way up to the professional athlete that's trying to get back to their specific sport. What I really love about my work is that I feel like I have the ability to really make a difference in making people more functional and overall just giving them a better quality of life. Part of what I enjoy is I could have a patient that is having a really hard time trying to do the things that they need to do. And sometimes even just simple treatments, just changing their shoe gear or doing an injection or putting them into a boot. Before they know it, maybe we can get them back to the things that they enjoy. My favorite part of the workday is really just being able to spend time with my patients. I really like to interact with them and just figure out who they are beyond just their condition. Ultimately, everyone's condition is going to be a little bit different, and so part of the fun of my job is really just trying to find a treatment plan that really seems to work best for that particular individual. So when I'm not at work, I am pretty much on the go. I'm a very outdoorsy person, so I like to hike and I like to camp. But one of my deepest passions is distance running. And I've been basically running since high school and college. I've ran a couple marathons to date, and I have goals on being able to hopefully run a couple more.